Okay, hi, my name's Salinas. This is Kevin Bauer. This is my Gen Med video. So we're going to start off with the blood pressure. Just going to get right into it. Okay, so if you can have your left arm out for me, please. So you're going to put the blood pressure cuff on the bicep. Make sure it's nice and snug. Making sure that the artery is lined up across for the brachial artery. And then put that on there. And we're going to put the stethoscope on the elbow joint anterior surface. And normally, patient blood pressure will be around 120 over 80. So we're going to pump it up. About 160. We're going to slowly release the air. So what I got was 124 over 76. So that's within a normal range. If he was over 120, then we'd start kind of looking at hypertension, stuff like that, but that's totally fine. And then we're going to be taking his temperature. And that will be normally within a normal limit, 98.7. So we're just gonna put a cover, protective cover, to make sure that it's sterile. Put in there. And if he's exercising, anything like that prior, or if he's nervous, the temperature can rise just a little bit, but we'll take a look at what it says. 98.2 within normal limits, totally fine. Okay, so next we're going to start by taking his pulse and his respiration simultaneously. His pulse will be within 60 to 100, which is totally fine, totally normal, and his respiration should be around 12 per minute. So I'm going to have his arms across his chest on his radial pulse with my right hand, and I'll be timing that while also doing respirations and taking his pulse. So he's at 15 for 15 seconds, so times that by 4, and it will give you 60 beats per minute. And then his respirations were 3, 4, 4, so he will be at 12 per minute as well. So he's in great range, totally fine. So next we'll be doing the otoscope. And so we'll make sure that we put a fresh sterile tip on here. So I'm gonna have him actually turn the fine. So we'll make sure that the light works here, and then we're going to pull the ear back and have it in my left hand for his left ear. And we're going to go through the canal and look for anything abnormal. Is that fine? Yeah. Okay, so here's them at the end. So we're looking for the tympanic membrane to see if there's any damage to it, checking any CSF in the ear, and any damage at all, any redness, stuff like that. Is really what you're looking for. Also, before we even go into mention on the external ear, you want to look for any kind of redness, any skin conditions, anything that could be cancerous. So that's that. Are you making more noise? Okay. Okay, so next we will be doing the Weber's test. So normally we would have a tuning fork, but for now we're going to have a kitchen fork, and I hope that's okay. So first we'll be doing Weber's test, and following we'll be doing Ryan's test. Both testing for air conduction and bone conduction of the ear to make sure that the nerves are working, there's no damage to the ear, inner ear, and yeah. So we would normally hit it, and it would start vibrating, making a noise, and we're going to place the end on the middle of the forehead, just between both ears, making sure they're equidistant. So then after that, we would ask him if they could hear it equally on both sides. If you can, that's good sign. If you cannot, then there is damage to one of the ears, whichever you cannot hear as well. Next, you would be doing Ryan's test, so we would hit the tuning fork again. We'd place it on the mastoid process, which is on the back of the head, left and right side. So you would place it here, ask him to signal once he stops hearing the vibration. Once he stops hearing it, you place the tuning fork end outside of the ear, so then you would hear the same, if not a little bit better. If there was a difference between one or the other, there might be damage to the ear at the cranial nerve 8. or any other damage, any kind of occlusion of the ear, stuff like that. Next, we'll be palpating the lymph nodes. So we're going to start with the anterior cervical lymph node. So we'll be palpating just outside of the Adam's apple, I guess, if you wanted to say that. So the noticing firmness, any warmth to it, if there's any enlargements, anything like that. So then next you'll be going under the mandible, so the submandibular lymph nodes, and feeling for the same thing. Okay, last part of the exam is going to be the throat evaluation. So we're going to be looking, generally, we're going to be looking for any kind of skin conditions on the outside and the inside. We're going to be looking for any dental issues like gingivitis, loose teeth, broken teeth, whatever, what have you. So you use the otoscope for examining. So we already switched the instruments. So now we're going to have generally just a light. Normally we would have a tongue depressor, but now we're just going to use the fork for the end. So I'm going to have the patient open their mouth. So if you can open your mouth for me, great. You're going to use a tongue depressor to press on the tongue. Can you say ah next? You're looking for the uvula to make sure that it is basically midline. If it deviates to any side, there could be damage to cranial nerve number 9. There could be a tumor or any kind of infection, stuff like that. Also, I'm going to look back again. Say ah, looking at the tonsils to make sure that they are pink and healthy. If they are white or swollen, infected, stuff like that, something to be concerned about. And that's generally it. That is the end of my evaluation.